All right, so this lecture today. We're going to take a little bit of a look at the male anatomy for the reproductive system. Similar to the female anatomy, it's going to be broken up into a couple different sections. Just to rehash again, so we're talking specifically about the gonads, which are the testes in the male reproductive system, and then their function for producing specifically sperm. So the male reproductive system essentially is broken up into two different specific parts. So the testes themselves, and then the system that leads away from them. So the system that leads away from them is the epididymis, the ductus deferens, or what's also known as the vas deferens, the ejaculatory duct, and then the urethra. I would make sure I take a note of this order because most often this is one of those that shows up as a question on the assessment. And they're going to ask you probably to put it in order, or they're going to ask you where does it move from one to the next. Okay. There are several accessory organs that go along with the male reproductive system. Most of these accessory organs are what are responsible for the bulk of what makes up semen. So we have the seminal vesicle, the prostate gland itself, and another gland called the bulbal urethra. And then there is the external genitalia for the male, which is simply just the penis as well as the scrotum, which houses the testes. All right, so each testy is broken up into four what are called seminiferous tubules. These little tubules are actually the sperm forming factories. So that's where the sperm actually starts to divide through meiosis. And then they empty into the ret testes, which then carries into the spermatocord, which then leaves the testes. Okay. Interstitial cells that make up the testes themselves are the ones responsible for producing the testosterone or the hormones that are produced by the testes. Testosterone, its main production, what it really does is help stimulate the reproductive organ development. After that, it then provides the specific sex drive that males have. And then it causes all of these different types of secondary sex characteristics. So deepening of voice, increasing hair growth, enlargement of skeletal muscle tissue, as well as thickening of bone tissue. This just shows real quickly how that is kind of controlled. Again, it's a negative feedback system. It's controlled specifically by the hypothalamus, and then those two specific hormones, FSH and LH. And then if there's not enough testosterone in the system, this just gets kicked in. If there's too much, then obviously it can be slowed down. This is also one of the reasons why if males take artificial testosterone, it can cause an issue with these two hormones because the body continually senses external testosterone and just mistakes it for testosterone that's being produced by the body. So now the FSH and LH stop being produced, and then the testes themselves can start to kind of shrink in those cases. All right. The next section then is leading away from the testis itself is the epididymis. All right. So the epididymis is kind of this comma-shaped set of tubules. All right. They lead away from the organ, and then they would carry sperm up into the spermatocord. Right. These are the sections that kind of run along the posterior kind of lateral side of the testes. And this is where sperm cells usually will sit for a period of time to kind of mature. They can sit there for up to 20 days. The next tube in line then is the ductus deferens, or also known as the vas deferens. This is what's carrying sperm, especially mature sperm, away from the epididymis into the ejaculatory duct. This is the connection from the testes into through the inguinal canal to the bladder. The process that moves the sperm is simply just peristalsis, similar to when you swallow something into your esophagus. It's just that rhythmic contraction of muscle tissue. The vas deferens then is part of what we refer to as the spermatocord. So the spermatocord is the ductus deferens, the vas deferens, the blood vessels that serve the testes, and then any of the nerve endings that lead into and out of that area. And then obviously the ductus deferens ends as the ejaculatory duct that eventually ends up in the urethra. As far as injuries, especially in sports, it's been a while since I've kind of mentioned one of those, but we'll bring it up now. This spermatocord, because of the way that it sits along the back portion of the testes, can actually become strangulated, meaning that it can become twisted. It's not unheard of if a male athlete takes a blow to the testes, or I've heard of cases where people have throwing up. I actually had a kid in a camp one time, ate an entire pizza by himself and then got sick. He threw up several times during the evening, and then all of a sudden he became very painful in this area. And what we learned after we got into the emergency room is that he had a spermatocord torsion. All right, so the tube actually twisted on itself, strangulating or cutting off the blood flow to the testicle. And then eventually he had to have surgery to untwist that. And then usually after they untwist it, they can actually stitch it to the back portion of the scrotum so that it can't twist again. But that's one of the things that we can end up with that, especially if they have an issue. Okay. The vas deferens itself is also the duct that is normally cut during a vasectomy, and that by cutting that, then we don't allow sperm to travel from the testes into the ejaculatory duct. Right? It's a simple procedure. In most cases, it can be done without a scalpel. But what they do is they essentially tie off both ends of the vas deferens, and then they usually cauterize the ends so that they can't join back with each other. Okay. The next one in line then is the urethra. So this is the portion of the tube that extends all the way from the urinary bladder to the end of the penis. Carries both urine and sperm to the exterior of the body. And then the only way that sperm can get into that is through the ejaculatory duct that is just in front of the vas deferens. Okay. There's three basic portions to the urethra. There's what's called the prostatic urethra. This is the portion that is surrounded by the prostate itself. All right. There's the membranous urethra. So this is from the prostate urethra to the penis. And then the spongy urethra. This is the one that runs the length of the penis. Like I was saying, these are some of the accessory organs. We have the seminal vesicles. These are located at the base of the bladder. They kind of surround the ejaculatory duct. The seminal vesicle produces kind of a thick yellow secretion. This is what makes up about 60% of semen. And it's comprised of a couple different things. It's comprised of sugars, fructose, vitamin C, and some prostaglandins, some hormones. And the main purpose of this is to kind of help nourish as well as activate sperm cells at this point, get them ready for their journey. Next organ that is the prostate. That's the one that actually encircles the upper portion of the urethra. It produces kind of a milky fluid. And its main purpose is also to help activate sperm, and it enters the urethra through those small ducts that kind of lead into the prostate gland. The last one then is the bulbourethra. This is a pea-sized gland in the inferior portion of the prostate, so it's right at the very bottom. It produces sort of a thick, clear mucus, and this one is usually produced at the beginning of sexual arousal to help clean out any acidic urine that may be in the urethra. As well as lubricate the canal itself for intercourse. Semen itself, just kind of that real quickly. So we talked about the ones that make it up. So it's a mixture of both sperm, seminal fluid, as well as bulbourethral fluid. It's usually about 2 to 5 milliliters of fluid itself. There's normally about anywhere from 50 to 100 million sperm in each milliliter. Advantages of this, because there's both fructose, there's an energy source in them. It's also alkaline, which helps kind of neutralize the acidic environment of the vagina as it goes in. The semen also inhibits bacterial growth, and then helps eliminate any elements. It also helps the semen sperm mobility. Okay. The scrotum is just another part of the external genitalia. It's divided in a sac of skin. The line that runs down the center of those, if there wasn't any testosterone produced, the scrotum would actually turn into the lips of the vagina. So they would turn into the minora as well as the minor. Okay. It maintains, main purpose of it is to kind of keep the testes at about 3 degrees Celsius lower than body temperature. Anything close to body temperature of this 3 degrees really kind of destroys their ability to kind of produce viable sperm. So it helps to try to regulate temperature for the testes. Penis itself obviously forms two functions. It's there to deliver sperm into the reproductive tract. There are three regions that make up the penis. So there's the shaft, right, which is just the long circular portion of it, the glans penis, which is the enlarged tip of the penis, and then the prepuce or foreskin, which most often is removed during circumcision, but it's just skin that kind of encircles the end of the glans penis. All right. External genitalia, continuing here a little bit. So internally, there are three areas of spongy erectile tissue in the urethra. And what those do is they fill up with blood to cause the erection. And then this real quick, spermatogenesis. There's not going to be a lot of questions about this on the assessment, but I just wanted to cover it real quick. So spermatogenesis is the same as oogenesis. We're just producing sperm cells this time. So it begins at puberty. The difference is in male, it will continue throughout their life. And again, it occurs in those seminiferous tubules. That's the big thing that really shows up as a test question. So make sure you kind of have those. All right. Again, we're producing 4 cells, except this time they don't happen the same process as the eggs. Again, they're haploid cells that are being produced here. Spermatogenesis, the main thing I would kind of remember, it takes about 64 to 72 days. And really what we're just producing are these mature sperm cells. Okay. All right. We're going to go ahead and stop there. Last thing we have to finish up then is infertility, and we'll talk a little bit about that when we get back from Thanksgiving.